Hello and welcome. Today we're delving into a topic that's incredibly important for students, families, and educators alike: how neuropsychological and psychoeducational evaluations relate to academic performance. Joining us is Dr. Haywood, a neuropsychologist who specializes in helping children and young adults unlock their learning potential. Thank you for being here, Dr. Haywood.
Thank you so much for having me. I'm excited to share some valuable information that could really make a difference in how we support students' academic journeys.
To start, what is the difference between a neuropsychological evaluation and a psychoeducational evaluation?
Great question. While both types of evaluations look at how a person learns and processes information, they differ in depth and focus. A neuropsychological evaluation is more comprehensive, and it examines a range of brain functions such as memory, attention, problem solving, language, and emotional functioning. It can also assess academic skills and abilities that underlie academic performance. It helps us understand how the brain's health impacts learning, behavior, and daily life. On the other hand, a psychoeducational evaluation is primarily geared towards someone's learning style and academic skills, such as reading, writing, math, and often attention and executive functioning as well, specifically how these functions relate to school performance. It's especially common in school settings to determine if someone qualifies for special education services, diagnosing suspected learning disabilities, and creating personalized strategies and recommendations for school and life. In short, neuropsych evaluations are broader, while psychoeducational assessments are more tailored to academic skills. Both types are powerful tools. They help you understand why things might feel so difficult, and they guide concrete next steps to help you and your child thrive.
Suppose I'm a patient who was recently referred for a neuropsychological evaluation, and I'm experiencing memory and concentration issues. How could this test help me understand what's going on?
First, I want to say it's good that you're looking for answers. Memory and concentration challenges can be frustrating and often impact someone's self-esteem. It helps to explain why, despite high effort, progress stays low. Through a neuropsych testing, we look at different aspects of thinking. We even look at how stress might be affecting you. Our goal is to identify whether there's an underlying brain-based issue such as ADHD, a learning disability, or medical condition, or if challenges are more related to stress and emotional difficulties. More importantly, we'll translate results into practical solutions, whether that strategy is for memory, for environmental adjustments, or even recommendations for therapy or further medical follow-up.
Imagine I've been diagnosed with ADHD, but I'm still struggling academically. Would a neuropsychological evaluation help me secure accommodations for school?
That's a really common scenario. A neuropsych evaluation is more than a tool for getting accommodations, though. It's a roadmap for understanding all the ways ADHD and other challenges impact learning. While an evaluation can provide crucial documentation for accommodations, its true value is broader. It identifies strengths, pinpoints specific difficulties, and suggests interventions tailored to a student's unique needs. This helps schools offer not just accommodations, but targeted supports like executive functioning coaching, strategy instruction, and more. It can also aid in developing an appropriate individualized education plan, or IEP. So yes, it can help with accommodations, but its great benefit is helping everyone, students, families, and educators, understand what supports will help that child thrive.
If I were a student who struggles specifically with reading comprehension and test anxiety, how would a neuropsych test or psychoeducational testing identify my strengths and weaknesses? And how would the results help me practically in school?
Psychoeducational testing would give detailed profile of your learning abilities, highlighting not just challenges, but also strengths you can build on. For reading comprehension struggles, we'd assess decoding, vocabulary, processing speed, memory, working memory especially. And with test anxiety, we'd see how anxiety affects performance and whether accommodations like extra time or a quiet setting are needed. Practically, these results help teachers individualize instructions, allow for specific accommodations, and often guide referrals for supportive services, like reading specialists or counseling for anxiety. The aim is to transform test results into real-world strategies that make learning more effective and less stressful.
Suppose my main concern is getting extra time or other accommodations for my university exams. If I came to you for assessment, would you recommend psychoeducational testing or neuropsychological testing, and why?
The choice depends on your specific needs and any medical or developmental history. If your challenges are primarily academic, difficulty reading, writing, or processing information, a psychoeducational evaluation might be sufficient. However, if there are broader cognitive, attentional, or emotional concerns, a comprehensive neuropsych evaluation would provide a fuller picture and stronger documentation for accommodations. We would discuss your background and goals to decide together which path is most appropriate.
In addition to extra time, what are some other common accommodations that might be recommended?
There are actually quite a few options. Some include access to assistive technology, like dictation programs or text-to-speech software for writing and reading tasks. Many students benefit from testing in a separate, quiet environment or using noise cancellation headphones. Others might receive teachers' notes in advance to review, permission for test questions to be read out loud or reread, or the flexibility to take supervised breaks during exams. The evaluation guides us in recommending the accommodations that match your specific profile and learning style.
Suppose my evaluation results show clear cognitive challenges. How might you help me use these results to improve my day-to-day functioning or quality of life?
Our job doesn't end at the report. We work with you to turn your results into practical action plans. That might mean training in memory strategies, organizational skills, or self-advocacy techniques. If emotional factors are impacting you, we might suggest therapy or provide coping skills training. We tailor our recommendations so you can implement changes at home, school, or work, always with the goal of boosting your independence, confidence, and overall well-being.
Imagine I had a neuropsychological evaluation 5 years ago. What are some reasons why a reevaluation would be helpful?
A previous evaluation serves as a baseline. Reevaluation is important if you've experienced new challenges, especially as academic demands grow more complex. It helps us see whether supports and interventions are still effective or if adjustments are needed. As students transition from high school to college, sometimes new emotional or behavioral concerns emerge. Other times, a student is either catching up or falling behind expectations. Reassessment helps ensure you have the right accommodations and support, and also guide teams in updating IEPs or 504 plans.
If I feel overwhelmed by the amount of information provided after my assessment, how would you help me prioritize recommendations and next steps?
Feeling overwhelmed is totally normal. After your evaluation, we sit down together and break everything down into manageable steps. We talk through your immediate concerns versus long-term goals, then create a short list of high-priority actions. We also provide written summaries and can coordinate with your school, counselor, or healthcare provider, so you have a clear roadmap, support in navigating the next steps, and reassurance that you're not alone in this process.
Thank you, Dr. Haywood, for your expertise and compassion, and thank you all for joining us today. Remember, seeking help and understanding your learning profile is a journey, not a destination. If you have questions, reach out to a qualified specialist. Wishing you all the best on your path to academic success and well-being. If you're interested in more information regarding neuropsychological testing and cognitive remediation therapy, make sure to click the link below to our other videos. Thank you so much.